Okay, time for everyone's favorite topic, right? What contraindications are there? Ultrasound has contraindications for kind of similar to our e-stim, but then also very similar to our heat, right? If we're using thermal ultrasound, all of those same thermal um, contraindications are going to also appear because it's about raising the tissue temperature. So we're going to see both of those. So contraindications for therapeutic ultrasound, any acute injuries, we wouldn't want to be doing our thermal, right? So we could do non-thermal ultrasound um, on acute injuries. So in the inflammatory response phase, so right, our 5 signs of inflammation have either disappeared or are decreasing and not fluctuating anymore. But anything that is in that stage, we would not want to increase temperature for. So we would not want to do our thermal settings. Impaired circulation, ischemic areas, sensory deficits, deep vein thrombosis, cancerous tumors, infections. So far, all those are kind of the same that we've seen for e-stim, the same that we've seen for our cold and our heat. Those are always our big ones, right? If they can't sense what we're doing, they can't tell us if things are getting too hot, then we have problems there. We don't want to ever break a clot open and away and send it up to the heart or the lungs, so that's almost always an issue. We don't want to, again, increase the activity, right? The whole goal of a lot of the ultrasound is to increase that cellular activity, kind of putting in that healing mode, alter the cells. We don't want to do that on cancerous tumors because we don't want to spread that cancer around, or we don't want the tumor to grow. Ultrasound, we do not want to do over any fluid-filled cavities. So the eyes, that should be the heart, not the heat, skull, carotid sinus, and genitals. Again, thinking about that the ultrasound is going to do that cavitation and that microstreaming, all that fluid in the area is really going to transmit the ultrasound, more likely to get potentially our standing waves as it moves through there and then hits something solid. So we just don't do it over any fluid-filled cavities. And then we have similar things over implanted pacemakers. Pregnancy or a woman menstruating over the pelvic or low back area. There's a couple articles out there that, again, heat and the ultrasound can stimulate more bleeding during menstruation. It's just, I would say that's more of a precaution or something just to bring up with your patient, like, hey, you might notice this. But for the pregnancy, for sure, don't. Active fractures or stress fractures, ultrasound will actually be very painful because it's vibrations, right? And one of the ways we check for stress fractures is potentially like a tuning fork. Well, an ultrasound is really a high frequency tuning fork. And so when you put those vibrations in, if there's a crack, if there's a fracture, the two ends are going to vibrate and they're going to be rubbing on that, and that's going to be very painful. So actually there's some people who use ultrasound to help quote unquote diagnose stress fractures. Um, it's debatable on how well it works or not, but it's just another tool that some people use. Metal or bony implants, again, because of the heating, especially joint replacements. If they've used cement in the joint replacements, which almost all of them do, that cement can hold the heat much more significantly, and so that can be a dangerous situation. And then we'd want to just make sure we're using caution over the vertebral column, any nerve roots, any large nerve plexes. Again, remember when we were talking about collagen, those structures that have a lot of collagen are going to be much more likely to really take on the ultrasound and absorb the ultrasound. Well, nerve is one of the big ones that will actually absorb a lot of that. So we just want to be careful that we're not overheating those areas. There's also debate on open epiphyseal joints. So again, people who are skeletally immature and those growth plates are still open. More and more research coming out that the ultrasound doesn't seem to affect or artificially close those early or things like that. But it might be something that you'd want to check with your physician or the physician working with that patient to make sure what their beliefs are. And same, again, with the metal, especially if the metal seems to be deep enough, it doesn't seem to be a problem. if it's coming out like an external fixation, then you definitely don't want to do the ultrasound over that area. But if it's internal, there's mixed debate on whether that's a problem or not.